States and territories have reacted, imposing travel restrictions on those who have visited Greater Melbourne exposure sites. Got a list of them here, so bear with us. In New South Wales, anyone who's been in the Greater Melbourne area is required to fill out a declaration form confirming they haven't been to an exposure site. Those who've visited areas of concern will be required to self-isolate for 2 weeks. Queensland has declared Melbourne's city of Whittlesea a COVID hotspot, so anyone who's been in the local government area since the 11th of May must enter hotel quarantine. From tomorrow, all Sunshine State arrivals from Victoria will also be required to complete a border pass. In South Australia, almost everyone who has been to a Greater Melbourne exposure site is banned from entering the state. Essential travellers can enter, but they must self-isolate for 2 weeks and then get tested for COVID. Travellers already in South Australia who visited a listed venue must self-quarantine for 14 days. In WA, Victorians entering the state will be required to receive a COVID test and isolate. New arrivals are not allowed to use public transport until they've returned a negative test. Anyone who has visited an exposure site in Victoria needs to self-isolate for 2 weeks. Let's go to Tasmania. It's declared the city of Whittlesea a COVID-19 high-risk area, so anyone who's been there since May 6 should self-isolate until a negative result is returned. And travellers who visited a listed exposure site will not be allowed to travel to Tassie unless they are classified as an essential traveller. For the NT, anyone who's visited a Tier 1 location must get tested and quarantined for 14 days, regardless of the result. Those who've been to a Tier 2 site can stop quarantining once they test negative. And New Zealand has suspended its quarantine-free travel with Victoria for at least 72 hours. Officials say it's a necessary step as the outbreak remains under investigation, but the decision will be under constant review.